So 4 of these are about the China response and its way forward, and 4 are about the global response and how we move forward. So the first, on the China side, I want to speak to the strategy that they've used. I'm going to speak to the collective action that powered it. I'm going to speak to the impact that it's had. And then finally, where we go with the recovery and next steps. So first, what has China done?
首先，中国做了什么？
So in the face of what has been a previously unknown disease, China has taken one of the most ancient strategies for infectious disease control and rolled out probably the most ambitious and I would say agile and aggressive disease containment effort in history. China took old-fashioned measures like the national approach to hand washing, the mask wearing, the social distancing, the universal temperature monitoring. But then very quickly, as it started to evolve, the response started to change. And it moved from this sort of one-size-fits-all approach to a science and risk-based approach, which was really tailored to allow it to use different containment approaches and measures depending on the context, the capacity, and really the nature of the coronavirus circulation. So they refined the strategy as they moved forward. And this is an important aspect as we look to how one might use this going forward. And a couple of things have differentiated it. The first, they took this old approach and they really turbocharged it with modern science and modern technology in a way that was unimaginable even a few years ago. And just a couple of small examples. As they cleared these giant hospitals to make space for overwhelming numbers of COVID-19 cases, they moved a huge amount of the routine provision of medical services onto online platforms and other mechanisms that they've really come to a cutting edge with. And when we were in Sichuan wondering how they were working with the remote areas, they showed us that they had prioritized the rollout of a 5G platform so that they could do real-time contact support with investigators in the field. And we asked to see it. And in 2 minutes up on the big screen, they had pulled up an investigation team that was in the field, was having problems with something hundreds of kilometers away, and was getting walked through it by the top experts from the province. So we gave lots of attention to trying to understand the strategy because it's fundamentally different to the way most people think about approaching a dangerous respiratory pathogen in the modern era. This brought us to the second big issue about how did they make it happen, make this strategy actually translate into impact. And what they've done has only been possible because of a tremendous collective commitment and will of the Chinese people, from the most bottom level community leaders we met and talked to the governors at the very top. It was an extraordinary, what we call all of government, all of society approach that many of you are feeling because you live here and you operate in this, but it is rare to see that. There was one aspect of this that struck us as particularly important. You've been hearing about the challenges we're having with the global supply chain around PPE, and many countries stockpiling or hoarding this. But what we found was, even though every province was suffering outbreaks and was getting infected, the governors were prioritizing the movement of medical teams and PPE out to Hubei and Wuhan. And that's a very important message for the rest of the world about how we work in the kind of solidarity and collaborative action that's going to be needed to beat this virus. So first, understanding the strategy was key, then how it was applied, and they got to the incredible level of application. But the key thing, of course, is, has it made a difference? Has China made an impact on this virus? And it's the opinion of the Joint Mission, after looking at this very, very closely and in different ways, that there's no question that China's bold approach to the rapid spread of this new respiratory pathogen has changed the course of what was a rapidly escalating and continues to be deadly epidemic. I think one of the most compelling statistics is when I arrived here on the first day, just over 2 weeks ago on, I can't even remember the day now, I think it was the 9th or 10th of February. Anyway, it was, there were 2,478 new cases of COVID-19 being reported every single day, 2,500 cases every single day when I arrived. So 2 weeks later, on the last day, as you probably know, the number of reported cases here is 416. That's an 80% decline, and the decline that we're seeing is real. Now, I know there's been challenges with the statistics that have come out of China sometimes with the changing numbers. And what we've had to do is look very carefully at different sources of information to say, if we could, with confidence, that this is actually declining. And when you get out into the field, there's a lot of compelling data and observations to support this decline. First is the steep decline in visits to fever clinics. In one province that we went to, it's dropped from 46,000 at one point, almost, I can't remember, weekly, daily, or for the whole province, down to 13,000. So dropping very, very quickly, despite a heightened awareness and push to get people in and get them tested. The second thing we found, and I think Dr. Liang was to my surprise a little bit, yesterday in Wuhan, was as we spoke to the physicians, they were saying, you know, finally hospital beds are opening up so we can move people in. And this was the first time in weeks that they felt there's more than enough capacity. I'm careful how I say that, but they actually had space. There's another strong indicator, because these are clinicians, no role in the big numbers and statistics, saying, look, we can actually see the space to move people and care for them properly. And one of the things that really struck me yesterday, I was speaking to a researcher, a Chinese researcher called Xiaobin, I always pronounce his name wrong, who is running one of the most important antiviral trials in Wuhan right now. And when I asked him what challenge they're finding in trying to implement the trial, he said the single biggest one is recruiting new patients into the trial because of the drop in cases. And I wanted to spend a little bit of time on that issue because I know that people look at the numbers and say, what's really happening? And we do as well. I mean, I work for WHO, yes, but I had 12 people with me who work for the best institutions, research and public health institutions around the world, and they wanted to be convinced. And very rapidly, multiple sources of data point to the same thing. This is falling, and it's falling because of the actions that are being taken. So we were also interested in, given the huge cost that this and sacrifice made by the Chinese people to implement this, we wondered, well, what has been the gain in terms of cases averted or prevented? So we looked at the attack rates for the virus in Wuhan. We looked at circumstances in other parts of the country. We tried to look at how we could apply them. And then after going through a number of calculations, our assessment is that this approach, what we'd call an all-of-government, all-of-society approach with very old-fashioned tools in some ways, has probably definitely averted and probably prevented at least, well, tens of thousands, but probably hundreds of thousands of cases of COVID-19 here in China, which is an extraordinary achievement and so important to the health of this country. So this is the epidemic curve of the outbreak in China.
这是中国的流行曲线。
Now, this is not the work of WHO, this is the work of the Chinese CDC. First, let me give credit to the great people who did this. And what you can see here is this rapid exponential growth that occurred with this outbreak in late January and then right up through here, almost to the end, the third week of January. This is exponential growth. And what you would expect, you know, there's certain mathematics to infectious disease outbreaks. You expect a curve like that to continue going up and then follow a big line like that before it goes down as it runs out of susceptible individuals and transmission chains. And so what you see is this is rising, then it abruptly gets blunted, and it skews coming down like that which is a picture that often accompanies the use of some kind of measures to change the shape of the outbreak. So when you look at the difference between what the curve may have been like and what it was actually like, that probably represents hundreds of thousands of Chinese people who have benefited from this tremendous effort. And there's a couple of other graphics that can test your eyesight, but also explain a point. So here's the outbreak that happened in the whole country on the bottom. For the rest of the world, where this virus, you've seen in the last few days, is taking advantage to explode in certain settings. It wasn't easy, because what I didn't mention on this slide is every one of these lines represent a huge decision by policymakers and politicians in this country, leaders, to actually change the shape with big measures such as, you know, the suspension of travel, the stay-at-home advisories, and other incredibly difficult measures to make decisions about, but also to get a population to follow. And that's why, again, the role of the individual here in China is so important as well. So we said a lot of good things about it, but we also, Dr. Liang and I and the team, we also talked about the problems, and we're very frank about those. Like in any outbreak, crisis, we learn. We learn sometimes we need to move faster, sometimes we need to act earlier on alerts. We need to know better how to optimize the protection of frontline health workers, how to enhance collaboration on key gaps, even how to communicate and share information. We had frank conversations about those things and made recommendations to how they might be addressed as we go forward. So the last point on China is where next, as these numbers come down, because it is already starting to bolster its economy again, reopen schools in the near future, maybe some weeks, but obviously they want to get society back to a more normal semblance of what's the best way to put this? Probably the new normal, because this virus may be around, we were talking today, Dr. Liang and I, for months. You know, and as we dug into and came to understand the knowledge, the tools, the capacities that have built in China, it's, again, our conclusion that this is the right thing to be doing even now, even while we work to get Wuhan still under control and clean out other areas. The country should be getting back on an economic and social and health systems footing that it was before. The key is going to be to continue phasing the lifting of the different measures and then bolstering even the capacity that they have now. And this is another striking thing about the way China is approaching this outbreak. Because as the case numbers are going down, China is building more beds, it's buying more ventilators, and it's trying to strengthen its public health capacity. Because there's an acute recognition here that just as the Chinese forced the tail of this outbreak down, it could come back up again as people start to move again, the shops start to open, the restaurants open, schools open. It's a risk, and that risk is being managed very carefully. That brings us to the last point in terms of the global response. We will gain a bit of time, but we have to be using that time better than we are today. In this country, outside, we have long lists of research projects and studies, but we've got to prioritize those things that could get the knowledge we need to stop this faster and the tools we need to reduce the morbidity and mortality. And I'll give you one good example. There's only one drug right now that we think may have real efficacy, and that's remdesivir, as you've heard about. And Xiaobin is having trouble recruiting patients, not just because the numbers are falling, but also because we're doing lots of other studies with things that are less promising. And we have got to start prioritizing enrollment into those things that may save lives and save them faster. And that's a global issue, not China. It's a global issue. So for each of these areas, we found some really striking things here in China that are opportunities for the rest of the world, and also things that can be done better in China. And we're, in our recommendations, very explicit about what the answers to those things might be, which things should be prioritized, for example.
建议。
So we make 22 recommendations in 5 big areas for infected countries, for China itself, for uninfected countries. And then we make recommendations which are unique. It's the first time in 30 years of doing this kind of work we've put a set of recommendations like this in a report. And what we've done is we've put in recommendations for the general public, which we've never done before in a report like this. And that's because we want to emphasize this can't work without the collective will of the population contributing to it. And that's what really distinguishes this country, this response, and the ability to take these old-fashioned strategies, some of the earliest ones we had in public health, apply them to the most modern virus, and somehow do that. I've spoken for a long time, but we're dealing with an incredibly important issue at a very dangerous time as a new pathogen starts to spread around the world. And I wanted to make sure that after a very intensive program of work here, that we shared with the rest of the world just how extraordinary the effort was here. And it's not to praise China. It's to open the door and have the rest of the world realize there is something that can be done as people are starting to despair that, oh, what can we do? But now we're starting to see countries like Italy take extremely aggressive actions. What China has demonstrated is you have to do this. And if you do it, you can save lives and prevent thousands of cases of what is a very difficult disease. So I'll stop here, but as I close, I want to say a few words to the people of Wuhan. 25 years ago, I visited Wuhan to assess the capacity to eradicate, it was at that time, another virus, a dangerous virus. And the Wuhan I found was a fair bit smaller than today, but it was a bustling, energetic, lively place filled with wonderful people, with a great spirit as they went about trying to eradicate this disease I was working on at the time. But when Dr. Liang and I arrived in Wuhan 2 nights ago, it was a very different place. This city of skyscrapers and giant auto routes and a gorgeous hyper-modern train station was silent. It was a ghost town. And behind, every window of these skyscrapers that we drove past, there were people. There were 15 million people were staying put in one place for weeks at a time to stop this disease. As we spoke to the people we were working with in Wuhan, they said, this is our duty. We have to protect the world from this disease. This is our role. We'll play our role. And I just thought it's so important that we recognize that. And to the people of Wuhan, it is recognized. The world's in your debt. And when this disease finishes, hopefully we'll have a chance to thank the people of Wuhan for the role that they've played in it, because many of us, many other people here have suffered, but the people of that city have gone through an extraordinary period, and they're still going through it. And there's so many stories like that in this response. So Dr. Liang, thank you again for the opportunity to work with you. I probably will not be invited back for a long time because I talk so long, but it's so much to express and explain, and it's so important that the world understands it at this point, because every day we stop to think about this disease and make decisions, should we do it or we not, this virus will take advantage and almost double the number of cases. You have to move fast.